Sure thing. And I may not exactly answer the question, but let me take a little bit of roundabout. As you can see, roundabout is my MO here. Um, One thing in thinking about where Rocket is, and in thinking about sort of building this sort of foundation and bringing everyone together, um, and Nord has been referenced, and
Yeah.
many of us are wearing the Nord pin. Nord is one of those great kind of I'm not going to say clearinghouses, but a nice neutral ground where, of course, rare diseases can learn, organizations can learn from one another, and some of the industry partners who are consider themselves not just a therapy provider, but a true rare disease organization can come and engage in maybe ways that they're not used to. Um, we're really lucky in our community in that we have had remarkable um, partnership between our organization, which started out in 1980s, your traditional kitchen counter organization, has grown and grown and grown. We've now got 37 of us, primarily in Maryland, but also a few other states. And we're essentially a patient advocacy organization, but we've got our fingers in a lot of different pots. And some of them, actually a lot of them, are connected to industry and some of the challenges, that are out there. And by and large, we play together really nicely. But there are a lot of organizations and what could be their industry partners who don't. They're on different pages, and there's a little bit of let's say blame to go around for some of that. They have different expectations. Parents and patients, especially where there is no therapy currently, are pushing, and uh, they will push because their lives and their children's lives depend on it. And meanwhile, you and your FDA colleagues and those who are out there who are in part trying to safeguard are trying to go methodically. Thank you. And you get challenges there. And then you find challenges like with the physicians, where they don't want to listen. They were taught this way back in school, and they're going to do it this way. And so, trying to get everyone on the same page, if that is at all possible, is a lot of what this is all about. And when you aren't, making sure that you don't try to pound a square peg into a round hole. And to be perfectly blunt here, I know of plenty of industry providers who, because the patients aren't doing what they want them to do, they will try things to either go around them. Okay, there's an existing patient organization. Well, they'll go and they'll create their own patient organization through roundabout means. They will work around them. They will go to war with them. And that's getting nowhere fast. And so communicating throughout the process, telling and being very clear about what your expectations are with your partners, your potential partners, telling someone when you think that they're getting off track. Right now we're seeing some things with some of our physicians who are very interested in a very academic piece of the puzzle, which is great. But at the same time, we in the patient community and some of the others surrounding, we're going to say, that's lovely, and I know that you want to spend all your time there, but that is not something that is actually going to make a meaningful difference in anyone's life. So while you're doing that, can you parallel track it? So there's a lot of great stories out there. I think more often than not, people find that sort of base of commonality and can kind of talk and work through. But I will just say, if you find yourself at odds, go and get a marriage counselor for the two sides, because basically there will be failure all around if you find yourself at odds with any of your major partners there, and you will not be able to get where you want to go and deliver the therapies that you want to create.